guest of honor to inspect our stores before we usher her to the VIP tent. Ladies and gentlemen, the guest of honor has just stepped out of her car, and right now she's greeting the dignitaries that came in earlier. And as I said, we are going to allow her to inspect our stores. We are going to allow we have artificial intelligence. Yeah, I don't know whether you want to enter and handle whether it is possible. You
Park Karamoja. What is in the park?
Of the key stakeholders. The first one is that we don't have, actually we have a stock out of pediatric TB regimens. The available anti-drugs that we have is strictly for the adults, but we don't have the pediatric TB regimens. Another challenge in the fight against TB, which we experience here, is that there is an upsurge of malaria in this district, and it is almost reaching an alarming rate, and as a process, it has derailed, toned down the TB activities. We also have a problem with integrated child case management, which has not taken root in the district. We are also appealing to the key stakeholders to look into that. Finally, I want to end like this, that would like to acknowledge the effort of the Ministry of Health. They have really supported us in many ways. I would like to repeat, others were already mentioned, renovation of our only hospital, and many others. We are also grateful to USAID Baylor, which is championing TB cast campaign, and also conducting hotspot screening and testing. We are grateful to USAID Rights, which has supported us in organizing this function. We are also grateful to USAID Uganda Health Activity for their human resource support.
So you grow rice within those small farms without anybody touching you. And if you are touched, I'm already here as a Ugandan to advocate for you. Wow. Mama, we had a marathon run, and I've been in engagement with Stop TB and the Minister of Health, and we chose Honorable Mama to be a chairperson for us. Now, we are eagerly waiting for some funds to enable us construct a TB ward. Mama, thank you very much, and your minister for coming to bless this. May God bless you. Thank you very much for electing that chairperson. Is my brother. Please do so once again as comes 2026 and treat any of them in a apparently similar way. President Museveni.
Hoye! Hoye! Thank you very much, Bwana. Referral Hospital, since it is in the center of Bukit region, and currently it is even serving all the districts in the sub-region. So it would augur well and give sense if it is elevated to a referral hospital. After all, it's being rehabilitated to international standards. Why not? We can. With that, maybe again, the only other issue for the sub-region is the industrial hub. We are wondering why our single hub is not yet operationalized, and yet the rest of the hubs have already passed out the first load. But for us as Bukit, we are still lagging behind. So we wonder why. It's my prayer that when you get there, please help us to ensure that everything is done to ensure that.
For those who may not know me, my name is Dr. Stephen Ugo, and I'm also director of Mbale Regional Referral Hospital. I'm also honored to be with you here today. Just like last year when I was the director of LIRA, we also had a similar celebration, and I'm glad that today everything is going well. As a regional referral hospital, we are the referral hospital for the Elgon region, which consists of 17 districts and one city, with a population of about 2.5 million people. As far as the hospital we serve, we are the regional referral hospital that serves the largest catchment area in terms of population. As far as TB is concerned, in our region here, we have over 94 TB diagnostic and treatment facilities, with 3 of these facilities serving as hubs, with another further 3 facilities having facilities for molecular diagnosis of TB. As you all probably know, our region is one of the regions in the country that has suffered from a very high burden and mortality from TB. Butaleja district is no exception. Apart from TB, in this region we also still have leprosy, and much as it's a disease that does not attract a lot of attention, we still do see cases from time to time. As a region, we have had many gains in the fight against TB, but as you all know, the past 2 years have been difficult. As a result of the COVID pandemic, many of the gains that we had achieved have been reversed. And now is the time for us to work together to see that we regain these gains, these lost achievements, and also do better. The region faces some peculiar challenges, many of which have already been mentioned. We have had some few challenges with the supply chain, and of course, being a region with a lot of border districts, the high cross-border movements make it sometimes difficult for us to follow our patients and retain them. As a region, we are not just sitting down, but we have embarked on strategies to try and reverse some of these trends. We have increased our efforts in case finding. We are also working more with the community in case finding within the community, and we are also increasing our focus on the high-risk populations. We have continued to build the capacity of our health workers. We are also working hard to improve our treatment outcomes. We have embarked on efforts to increase our retention of patients, empower our communities, and also engage with our leaders in the region to strengthen our
driver to our country's Vision 2040. The theme for this year's celebration is Yes, We Can End TB. It inspires hope among TB sufferers and brings attention to TB and our collective power to end the epidemic by 2030. Additionally, the theme to foster high-level leadership, increase investment, sectoral collaboration, accelerated action, and adoption of technology and innovation to combat the TB epidemic. I'm impressed by the choice of this year's slogan, "What are you doing to end TB?" TB is a serious issue that can affect anyone and cannot be ignored. If we all embrace it, we shall be agents of change in our respective communities. We shall be able to change mindsets of our people, especially those who silently suffer from TB and do not seek care. Ladies and gentlemen, what don't we have? The brains and experts, the tools, informal policies and frameworks, stewardship, the peaceful and enabling environment ushered in by the NRM. It is unacceptable that we continue to lose 30 people daily. That's 91,000 persons developing TB annually and 240 falling ill. Moreover, a significant number are not identified by the alert system and therefore continue propagating the disease out there in the community. The Office of the Prime Minister, together with the Ministry of Health and partners, launched a multi-sectoral accountability framework for TB in November 2020. These and many other policies should not be shelved. I urge all stakeholders to take them as living documents to drive implementation.
Do our hospitals have the capacity to treat this disease? And you also talk about the issue of the stigma from the communities.
Yes, we have the capacity. We have the medicine is available. We have the medicines, and we have the testing reagents and machines. So we are not, every hospital is a diagnostic center. This center are 3s, this center 4s, this hospital, we have everything.
Have you tried to sensitize the people on avoiding stigma, because it seems to be one of the reasons as why people are not going?
That's why we have implementing partners who liaise with the district leadership and the health workers and the community health workers, the VHTs, to make sure that we get this from the communities and to sensitize them about stigma and the rest.
You receive for doctor. Somebody will say, we don't want to go back. The next group is yes, yeah. Rita Henry, Mr. College, and then Robert.
Well done.
Thank you very much. Of March 2023, I, Nakadama Rukia, the third Deputy Prime Minister of the Republic of Uganda, am launching the Uganda Zero Leprosy Roadmap 2022 to 2030. Congratulations, Minister of Health. Thank you.
Congratulations, Right Honorable Prime Minister. The request